A patient is strapped to a bed. She hasn't slept in 6 days. She speaks to people who aren't there. She's clawed her own skin bloody. Every treatment has failed. Her family has run out of options. Her doctor prepares a syringe, not a sedative, not an antipsychotic, insulin, a massive dose, enough to crash her blood sugar to near zero. Within minutes, her body begins to shake. Her back arches off the mattress. Her jaw locks. Her eyes roll white. Then stillness. She is now in a coma. Her brain is starving. Without glucose, neurons misfire, then go silent. She will hover here at the edge of death for up to an hour. Only a carefully timed injection of sugar will pull her back. This is not an experiment. This is her treatment. And it will happen again tomorrow, and the day after, 30, 40, 50 times, until doctors decide she's cured or her body gives out. Today, we would call this torture. But in the 1930s, 40s, and 50s, this was taught at Harvard, practiced at the finest hospitals in the world, celebrated in newspapers as a medical breakthrough. Families begged for it. And here's what should disturb you most. The doctors who did this weren't monsters. They were careful, methodical, genuinely convinced they were saving lives, which raises a harder question than, how could they? The real question is, how did this make sense? It started with an accident. Vienna, 1927. A young psychiatrist named Manfred Sakel miscalculates an insulin dose while treating morphine addicts. The patient convulses, loses consciousness, nearly dies. But when she wakes, something is different. The agitation is gone. The tremors have stopped. She seems clearer. Sakel doesn't dismiss this as coincidence. He leans in. He begins experimenting. Higher doses, deeper comas. And he starts to see a pattern, or believes he does. Sakel builds a theory. Mental illness isn't spiritual. It isn't moral weakness. It's mechanical. A brain stuck in a broken loop. And like any jammed machine, sometimes you don't fix it gently. You force a hard reset. Insulin floods the bloodstream. Blood sugar plummets. The brain, starved of fuel, begins shutting down. Patient sees bodies rigid, jaws clenched, then collapse into silence. Nurses watch the clock. 30 minutes, 40, 60, then comes the glucose. A syringe, a tube down the throat. The body jerks, eyes flutter open, and sometimes, not always, but sometimes, the patient seems calmer. That was enough. Psychiatry was desperate. Asylums were overflowing. Patients were locked away for decades. Families were told nothing could be done. And here came Sakel with something electrifying. A physical intervention, a biological explanation, a mechanism. It looked like science. It felt like progress. By 1940, insulin shock therapy was standard care. Entire hospital wings were built around it. Psychiatrists who didn't offer it were dismissed as outdated. The cure had arrived. And once everyone believed that, almost no one stopped to ask whether it actually worked. The cost of that belief was paid in hospital wards. The air smelled of sweat and antiseptic. Rows of beds, rows of bodies. Nurses moved between them, checking pulses, watching for the moment a coma tipped from therapeutic to fatal. The margin for error was razor thin. Too late with glucose, brain damage. A little later, death. And death came often. In some hospitals, mortality reached 5%. 1 in 20 patients didn't survive the cure. For over 20 years, the practice continued. Thousands treated, hundreds dead, and almost no one questioned it, because psychiatry had no way to measure success. If a patient seemed calmer, the treatment worked. If a patient died, the illness was blamed. Success was credited. Failure explained away. Until the late 1950s, when researchers finally asked, "Where is the evidence?" Controlled studies were run. Patients who received insulin comas were compared to patients who received nothing. The results were devastating. Both groups improved at roughly the same rate. The comas had done nothing, except kill 5% of patients and permanently damage countless others. The collapse didn't come from outrage. It came from numbers. Insulin shock therapy didn't end because it was cruel. It ended because, when measured honestly, it didn't work. We look back in horror. How could they let this happen? But the impulse hasn't disappeared. It lives in every promise of a reset. Every protocol claiming to reboot the body. Every authority offering certainty instead of evidence. When people are desperate, they don't ask for caution. They ask for action. And when belief outruns measurement, medicine doesn't heal. It experiments on the desperate. The question isn't how this happened. The question is, what are we doing right now that will look the same in 50 years?